Again, just wanted to extend a warm welcome to today's webinar, Managing Personal Information in Post-Secondary Education Settings for Students with Mental Health Conditions. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, and we're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kati, and I'm the project coordinator of this center, and we'll be introducing our center and webinar presenters today. The MHTTC is funded by SAMHSA to enhance the capacity of the behavioral health workforce to deliver evidence-based and promising practices to individuals with mental health conditions. We also address the full continuum of services spanning mental illness prevention, treatment, and recovery supports. And we provide training-related workforces to provide effective services to people with mental health conditions. We also offer training programs on EVPs for serious mental health conditions, wellness and recovery for providers and people with mental health conditions, Hispanic and Latinx mental health education, and online education courses such as Wellness Matters, IMR, Functional Thinking, and more. Next slide, please. If you're interested in staying up to date with the events and products that our center is offering and providing, we ask that you please sign up to receive our email communications. You can sign up either by the bit.ly link that you see on the screen, and I'll also include this link in the chat for an easy access to our email listserv. Next slide, please. Following this webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future training events. These surveys are also important because of our continued funding that is linked to their completion. So we thank you in advance for your participation. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted on our website within 7 days of this webinar broadcast. At the time of this presentation, Miriam Delphin-Rittman served as Acting Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time toward the end of the presentation. During this webinar, our presenter may pose questions to you, so please use the chat feature to answer them. Slide. We also wanted to let you know about the new 3-digit dialing code for the Suicide and Crisis Lifeline that is now available. 988 is not just a suicide crisis line. It is for people experiencing a suicidal, mental health, or substance use crisis or any kind of emotional distress. It's also for people who are concerned about someone experiencing a crisis. You can connect by calling or texting 988, or you can chat online at 988lifeline.org. Calls, texts, or chats are responded by a trained crisis counselor. Next slide, please. The MHTTC network is committed to using affirming, respectful, and recovery-oriented language in all activities. Next slide, please. And again, we're now going to begin our webinar. We have Amy Benko and Joni Dolce with us today. Amy is a lecturer in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers University. In addition to providing course instruction, Ms. Benko is a trainer and consultant at the Integrated Employment Institute of Rutgers. Within this role, she facilitates trauma-informed, supported employment, and supported education training and technical assistance to enhance practitioner competencies and program outcomes. She is a co-developer of the first mobile outreach supported education program in New Jersey and has amassed over 15 years of experience in the implementation, supervision, and evaluation of SCD and SC courses. Previously, Ms. Benko was a clinical contributor on 3 NIDILRR funded studies focused on post-secondary education and employment for individuals with mental health conditions. Additionally, Ms. Benko is a co-author of a best practice manual for providing supported education to transition-aged youth and young adults with mental health conditions. She serves as a co-investigator on 2 federally funded NIDILRR studies on post-secondary education, supported education implementation, mental health conditions, and trauma. She also uses her lived experience of a mental health condition to inform her roles as an instructor, scholar, and clinician. We also have Joni Dolce with us today. Joni is an assistant professor in the Department of Psychiatric Rehabilitation and Counseling Professions at the Rutgers School of Health Professions. Joni has several years of experience working in behavioral healthcare settings, namely supported employment. Joni teaches courses in the department's undergraduate program, as well as providing training and technical assistance to behavioral healthcare providers. Her research interests include staff training and employment services, and she presents nationally on the topic of employment services and is listed as a Society of Human Resource Management recommended speaker on the topic of creating workplaces that support mental health. Again, I want to welcome everyone today, and I'll turn it over to our presenters.
Thank you so much, Kati, for the warm welcome. So welcome, everyone. We appreciate you being here. Before we get started, we wanted to just kind of get you engaged a bit, thinking about a time that you may have managed some bit of personal information. We're going to talk about maybe the distinction between managing personal information and disclosure. So think of a time, and any time, it doesn't have to just be related to employment or education, where you managed some bit of personal information. You can write it down, or if you have a better memory than me, you can just think about it. We're not going to be looking at it as a group, but we will be referring to it a little bit later, and also maybe kind of the process that you were kind of going through as you were thinking about that personal information that you've managed in the past. So I'll spend a few seconds kind of letting you think about that before we move on. So
many experiences come to mind for me, Joni, and some of them are quite embarrassing.
yes. Embarrassing, and then some are also very critical, right? Like sometimes in my life where I had to manage personal information, whether it had anything to do with childcare needs or parents being sick, but it was certainly personal to me, and it was necessary to manage it effectively in my employment environment. At the time, I was attending school as well. So yes, think about that. So today, like I had suggested, we're going to distinguish between disclosure and managing personal information. We're also going to talk about some of the pros and cons of managing or disclosing sensitive information in education settings, particularly post-education settings, and then also apply strategies to help students with mental health conditions in managing their own personal information in post-secondary settings. So we have a pretty large agenda, and looks like we have several people here on the call. Amy and I also crafted this 90-minute session to include a pretty good chunk of it where we talk about individuals that you might be working with, where we kind of do some service conceptualization around managing personal information and post-secondary settings. So we're going to get started. So again, what comes to mind when you hear the term disclosure? So you can use the chat or unmute your mics. So when you hear disclosure, what comes to mind? What do you immediately think? Amy, if you could read the chat, that would be great. Thank you.
You got it. Nothing yet. I know. I think of, why does secret come to mind?
Secretive.
For me.
Yeah,
like a secret. I guess
Anything
people
else?
are still typing.
Okay.
Oh, here we go. We have self-disclosure.
Self-disclosure. Yes.
Yeah.
What else comes to mind when you hear the term disclosure? Anything else in there, Amy?
Nothing yet.
Confidential. Yes. So yes, all of those terms, limitations. Yes. So something confidential, limitations. Amy said secretive, maybe sometimes hiding something. They're not necessarily the most positive terms. So some researchers in our field, psych rehab field and education and employment services, are moving away from the term disclosure when we're referring to those types of disclosures in the work setting or in education settings, because it might imply that the student or worker might be hiding something, might imply some level of shame to whatever they're disclosing. So when we use terms like, thank you, Kenneth. Yes, I can see this right here, Amy, self-report, self-identification. So when we're kind of thinking about
Also safety and trust, which I
yes.
think is interesting.
Yes, very interesting. So as we're kind of moving along in today's presentation, I want you to really think about how just reimagining disclosure and reworking it and using the terms managing personal information kind of changes it to a more strengths-based approach, right? So, we're really looking at it from a strengths-based perspective. So we're not suggesting that someone's hiding something that they should be ashamed of. We're really looking at, okay, we all have personal information, just like you kind of wrote down or noted in your mind a little bit earlier that there might have been some personal information that you managed at some point. It provides a more empowered way of thinking about this topic. So Amy and I will use the term interchangeably throughout the presentation, but as we kind of move on, and when you move out after today's session and kind of into your own work settings, I would encourage you to consider kind of rewording disclosure to managing personal information. Jeff Waghorn and his colleagues kind of coined that a while back, and they've been doing quite a bit of work around managing personal information in the employment sector, as well as some in the education. So thank you for your participation, Amy.
Yeah, I was just going to say, unfortunately, a lot of the colleagues of Waghorn in other fields, thinking about the communication field, thinking about the education field, they haven't caught up in regards to the term managing personal information. So to your point, Joni, some of the literature that we're going to be referencing, the studies that we'll be, sharing and talking about, they use the term disclosure, and that's kind of what they reference in their studies. But please keep in mind that piece about managing personal information coming from a place, as Joni noted, as empowerment, building advocacy, coming from strengths-based perspective.
Yes, absolutely. We have the power and the ability to manage what we want others to know about us. Great. So there are some different types of disclosure. This study was done by Vanitas and colleagues. They looked at 144 college students. They studied 144 college students regarding their disclosure decision-making. Amy's going to get into a little bit more detail related to the efficacy and disclosures, but they kind of identified these three areas of disclosure. Third-party disclosure, kind of just as it sounds, really refers to having someone disclose on behalf of the person. So third-party disclosure may seem very attractive as a disclosure strategy when the information owners, the student who's choosing to disclose, perceive that others in their lives might be more effective at disclosing for them. However, among those who have disclosed, decreased efficacy is associated with increased use of this strategy. So, it's suggesting that when students are equipped with information, prepared and rehearsed, they have really rehearsed their disclosure, their efficacy increases. So third-party disclosure may be an attractive disclosure option. However, Amy and I are really encouraging you, when you're meeting with students, to identify ways to really promote the student to disclose on their own. If possible, that may not be a possibility for some. Incremental disclosure occurs when individuals share the least threatening piece of information to test others' reactions, and then they may determine whether or not they want to continue to share, and how much to share in subsequent disclosures to minimize negative reactions. Entrapment occurs when individuals disclose as though in an argument and feel forced to share the information, such as correcting others' incorrect assumptions. Perhaps someone might be saying something incorrectly about a person living with a mental health condition, so the person feels like they need to correct that information, so they might feel kind of trapped into disclosing more information than they want. Therefore, this disclosure approach may occur when individuals really aren't planning and haven't planned to disclose, or they felt compelled to disclose when they're not prepared. And this disconnect between intentions and behavior, suggesting that individuals do not necessarily plan to use entrapment, but when entrapment occurs, there can be regret. And Amy's going to talk a little bit about that disclosure regret when she gets to her piece. And then finally, this is where we want to be. We want to help people in the preparation and rehearsal type of disclosure. We want to help individuals plan for and practice disclosures. We want people to feel more confident in their disclosure and less uncertain, particularly when disclosing non-visible illness, like a mental health condition. Individuals report reduced efficacy is associated with increased planning. So among those who, remember this was a study of 144 college students, among those who contemplated disclosure, decreased efficacy was associated with increased rehearsal. So the more someone rehearsed and role played, the more their efficacy was decreased. Amy, you have any thoughts on that?
Yeah, I think it's interesting because I can refer back to my time in support education, Joni, and I can see having conversations with students. And they would report these experiences of having some, the third party disclosure, having someone try and, disclose for them. Maybe it was the Office of Disability Representative, or they felt that piece of entrapment, right? Maybe a professor was accusing the student of not being diligent, of not, doing what they need to do to pass the class, to get a good grade on the exam. And the student felt like, I'm a good student. I'm just experiencing a mental health crisis right now.
Right.
And now I feel compelled to explain myself and share something that maybe I wasn't intending to share. So yeah, I hear these, I know it's coming from literature, but it's definitely resonating in terms of my practice. I wonder if, folks in attendance, if you have observed these types of disclosure as well. We have one of the issues from experience is that there are still archaic policies that embed these types of issues that are not equitable and person-centered. Also, the bias and power differentials with administrations do not help in the level of support for a student. Yes,
Yeah.
absolutely. Very accurate in terms of the policies that can ultimately result in some of these issues, these challenges that are not person-centered. And we're going to talk about some of those pieces more towards the end of our session in terms of the ADA and the Rehab Act and where there might be, those gaps in policy procedure. Thank you.
Thank you. So we really want to just help the student avoid disclosures that they weren't planning to disclose. We want to help students prepare, and we want to help the student understand that those decisions that they make initially can be reevaluated over time. So it's, kind of moving away from the binary yes or no, yes, I want to disclose, no, I don't want to disclose, to a more multidimensional approach. What do I want to disclose? To whom? Maybe I disclose something to students and peers, but maybe, I'll be sharing more with the Office for Disability Services. So kind of looking at it in less of a yes or no kind of binary approach helps us to really encourage students to think about it, take some time, think about their own strengths and their own abilities, and help them avoid that inadvertent disclosure that they may not have been wanting to disclose, that entrapment or other feelings of being compelled. So we can move on to the next slide, Amy. So think about what you wrote down earlier. Let's revisit that. When you were managing your own personal information, did you think about some of these activities, you know, some of this on the slide here? When we think about managing personal information, it's most effective when the person, whether it's an employee or student or friend, whatever it might be, is clear about the purpose and the desired outcome. So think about your own example from earlier. Did you think, you know, what were you clear about what your purpose and what your intended outcome would be? Did you disclose to the right person? Did you do so in a timely manner, or was it, you know, too late? So my example, you know, with childcare, I had to make sure that before, you know, my maternity leave was over, I was, you know, I had to line up some plans in place to discuss my childcare issues and concerns. Are you able to articulate your strengths and skills and whatever other disability related needs? So can the person really articulate and really think about and describe to someone else what are their skills, what are their strengths, and what needs do they have? And this is where we come in as practitioners to really support and encourage someone to dig deep if necessary. Sometimes people have a hard time identifying strengths, have a hard time identifying skills, really help the person think about what that might be. And more importantly, is knowledgeable about their rights. So knowing what laws protect students and what their rights are. So that just kind of gives a quick overview of when it's most effective. You can move on, Amy. So Jeff Waghorn and colleagues have developed a managing plan, a plan for managing personal information. And part of that consists of these different areas. So we've kind of modified it to address the more education piece, but it really talks about career planning, education preparation, and education retention. So you can kind of see the sequence of someone's kind of life as a student, you know, working on career planning activities and then preparing for the education setting, and then also, you know, education retention, how to maintain as a student. It looks like there might be something here in the chat.
We had Leanna before agreeing, a firm agreement with what you were talking about in terms of coming from that strength-based perspective. And then we have removing punitive approaches, 3 strikes you're out approach. Many of this is unjust, especially in a system that has gatekeeping practices like financial barriers and sacrifices in post-secondary ed, time, perpetuation of representation issues in the workforce. Yeah, so removing punitive approaches. Would you say that is more, just to clarify, more in regards to academic performance and disability barriers to academic performance? Because I think that might be at least what I'm reading in terms of your statement, your comment, it is alluding to that. Just a quick clarification.
Yes.
So definitely. Oh, sorry. Thank you.
Yes.
Please go ahead.
No, I mean you're covering it. Yeah. So around the disability and whether that is in intellect, learning disability or mental health, like, you know, it's all kind of encompassed together. So yeah. So.
Yeah, and I almost read this as like a piece about, you know, ableism, and ableism
Yes.
in
Yes,
the
exactly.
post-secondary education setting can be very prevalent, especially, you know, in the classroom, when there are not support of accommodations, maybe lack of universal design, andragogical approaches. I can absolutely see that as, punitive in nature. Thank you. Great comment.
Thank you so much. Thank you. That's very helpful, and totally agree with what you're saying. So let's move into looking at the career planning phase. You can really focuses on that career development, helping students, potential students, early on finding a job or a career that they want to, that it's going to be a good match. So, you can see from this Venn diagram here, kind of looking at what you love, what your values might be, what your skills are, what your interests are, and helping the student identify what some of those are. So what are some career planning activities that you can assist potential students with? What are some specific tools and strategies to help students identify values, interest, preferences, abilities? You can use the chat or unmute your mic, whatever your preference. Wait a minute while people are writing. I'm sure you're all just writing feverishly in the chat.
Typing away. I think about, Joni.
The question
sorry.
was, what are some career planning activities that you can assist potential students with? What are some ways that you can help students identify values, interests, skills? Go ahead, Amy, I'm sorry.
Yeah, I was thinking about, the exploration of interests, and particularly learning about a person when I was in supported ed, about what they previously liked to do. You can learn so much when you chat with someone in terms of their interests prior to the onset of their illness.
Mm-hmm.
What did they engage in? What was, their daily activities? What did it include? Interests, hobbies, time spent doing certain activities. What were those activities? And do they want to get re-engaged with them?
Absolutely. What were the activities? What were some of the things the person liked, even disliked? When we talk about things that we didn't like about certain activities, we can we can begin to clarify values from that end too. So if someone doesn't like working outside or working with their hands, and someone prefers more independent type work, we can kind of help clarify those values. Kenneth has something here in the chat too.
Asking students about their coursework, what they're enjoying, why they are taking classes.
Yeah. Finding out their why, right? Like what is it about the coursework that's important to them?
And what was a really good indicator if someone was enjoying a course, Kenneth, to your point, you could see it in their nonverbals.
Oh, yeah.
Have you ever had a discussion with someone about a course or an interest and they just light up? They're animated, they're smiling. You can tell when someone is really interested in something just by the way that they are kind of presenting themselves. From Leanna. Oh,
yeah,
sorry, go ahead.
I was going to say, and then call the person out on that and say, Amy, whenever we talk about psych rehab, you just light up. Whenever we talk about, helping someone or career counseling, your face just, I can see a smile form, and start from that. Tell me about that. Tell me what makes me notice this difference in you.
Yeah. From Leanna, time management, stress management, coping strategies. So getting an understanding of maybe their strengths and some of the areas of need as they're embarking on that career planning, that educational planning. That's always a great piece to tie in to those interests, values, and preferences.
Absolutely. And I love that much of what people are saying really does tie it back to looking at the person's strengths, looking at the person's interests, kind of coming at it from that strengths-based versus just looking at needs and support needs. Kenneth, you had mentioned in the chat your favorite class. Amy, what's the rest of it say? For some reason,
I always ask what their favorite class is for the semester. They're surprised by being asked this, but they like to give the answer.
Mhm.
Absolutely. People enjoy talking about the things that speak to them. And they're always, I think engaged in those discussions. And that's a real opportunity, Kenneth, to build that therapeutic alliance, that working alliance or the rapport when you're demonstrating that genuine interest in what speaks to them.
Mhm.
And I think that can be leveraged in that career planning phase. Absolutely.
Genuineness is one of those key components for change, right? So just having that genuine relationship. You can move up, just touching on this last bullet here, helping students to identify automatic disclosure patterns. So that could be something like if the student hadn't been in school for a very, very long time, there might be gaps in their education history, helping students when they're planning disclosure and planning to manage personal information with other students or even professors, maybe planning some ways and rehearsing how the student might respond to that. What will be the student's response if someone says, well, I noticed you've been out of school for, over 3 years, 4 years, whatever that might be, helping the student even plan for those automatic disclosure patterns.
Yeah, and Leanna brings up a good point in terms of providing opportunities during this process, in regards to training discussions geared toward students with disabilities.
Yes.
So having that conversation of, in the career planning phase, I think is a great point. We want to include all pieces of a person's cultural identity during this process. And that includes, the presence of a health condition or disability.
Absolutely. And something else in the chat just popped up. Peer support and a peer support group would be a good something good to incorporate in this stage as well. I agree. Great.
That's a powerful component. Yeah.
Yeah. Thank
for
you.
Sure.
So I'm going to toss it over to Amy to kind of take us through some of these remaining steps and talk a bit more about the education preparation stage, and then we'll follow up.
Perfect. Yeah, so we're looking at the education preparation stage, and we want to start by exploration. We want to look at the advantages and disadvantages of disclosure, and we're going to get into some really good conversations in a minute about this process, because that can't be overstated. If there's one thing that we're going to look at today to support you practitioners, it's this piece about assisting the student in considering the pros and cons of managing their personal information. Then we want to review, and we're going to get into that in a second as well, right? The laws. It's important for students to know, right? What are their rights? What are their legal protections, so to speak, in terms of what happens when they manage their personal information or disclose in this setting, in the environment of school, post-secondary education. And then we're going to look at choosing the disclosure language. Not just to minimize stigma, but we also want the person, right, when they're managing their personal information, when the student is deciding the language, it needs to feel right for them. It needs to, meet their personal criteria. It needs to be worded in their own style, so to speak, that it feels genuine and true to how they talk and how they want to represent, right, their personal information. And then we're going to look at this piece on disclosure or managing personal information, and the benefits of such, including accommodations. But this is a process, I think, that will take you through, right, how to work with a student, especially in this education preparation stage. And some of it can be leveraged for that retention piece that Joni will be talking about later. So let's think about some reasons students may choose to disclose or to manage their personal information. What comes to mind for you? Maybe you're working with a student or have worked with students in the past, and they have shared with you some of the reasons that they were leaning towards disclosure, leaning towards that management of personal information. Put it in the chat box. What comes up? What do you think about in terms of why a student may choose to disclose or to manage that personal information? What have you seen? What have your students shared with you? Go ahead and put that in the chat. I've had so many of these conversations in the provision of supported education services I worked in the field for 10 years, and I could name a whole host, right, of things that students cited. So from Leanna, accommodation need. Yes, Leanna, the student is identifying that they have a need. And because of that need, they're considering how am I going about this discussion, right? I need a support, and to access that support, I'm going to potentially have to manage this information to disclose, to gain access to a support like extra time, like standing desk, right? Like having additional absences. Great, Leanna. Absolutely. Fabulous. Anyone else? Something that a student has cited.
In the chat, there were challenges that happened in the past where they did not disclose and had no support. More preparation in this chapter to make sure they have support. Absolutely.
Yeah, that's interesting. So they were looking to manage that personal information, chose not to disclose, and then they were left without that circle of support. They didn't have folks to reach out to. Yeah, thank you. So first and foremost, looking at the literature, right? And if something else comes to mind, please put it in the chat, but you got it. I hit the nail on the head in terms of the biggest cited reason for disclosing, for managing that personal information for college students is access to accommodations. It is a primary motivating factor for disclosure to access formal accommodations that the college provides to support students with mental health conditions or other disabilities. And accommodations can play that pivotal role in leveling the playing field, ensuring academic success, and to be able to get those accommodations, that active disclosure has to happen. Someone noted, I think it was it Leanna, who said support system, right? Another cited reason for disclosure is that students can connect with supportive faculty, staff, maybe peer networks, right? Their classmates that can understand, that can provide guidance related to, maybe the challenges that they are experiencing. Another cited reason for disclosure in the literature, this is from Black et al. 2015, they're looking at self-advocacy and empowerment, right? Some students choose to disclose a condition that they have, especially non-apparent health conditions, as an act of self-advocacy, right? An act of empowerment for the student to take control of their educational experience and to really come from a perspective of self-efficacy, asserting their rights. Other work, this is from Brockelman in 2006, reducing stress and anxiety, right? Students may choose to disclose or manage that personal information because they are in some way feeling like they're keeping a piece of their information secretive, right? And that's where I think we reflect on what Joni had stated earlier, that negative connotation with disclosure and how it may apply or assert pressure for some folks to feel like they have to share. Right? So some folks may feel like they have some anxiety or stress in keeping this personal information private. And so by engaging in some level of that managing personal information, sharing some of that personal information to the level that they feel comfortable, it may provide them a sense of relief, right? Knowing that they are sharing all facets of their cultural identity, including that identity of having a disability. Students may share, right, because of educational purposes. They might disclose to peers, to faculty about their condition. I know I did this in my graduate studies. There was a student in my class who was very stigmatizing about mental health conditions and what mental health conditions looked like for students in the classroom setting. They had very low expectations for students with mental health conditions. And I self-disclosed to let this person know, you are looking at a student with a mental health condition now, and and I am your peer, right? So we may provide that disclosure for educational purposes to reduce stigma in the process. Maybe to set expectations, in terms of letting people know their condition and knowing that, yes, I will have to take, additional breaks. I might have to get up and take a break from the classroom because I have this accommodation due to this health condition. Yes, I might need that extended time, right? So it's accessing accommodations and letting, their peers know maybe, or the professor know that there will be additional needs. And it might be influenced by campus climate. Campus climate is different across all universities, colleges, school settings. And sometimes that campus climate may be very positive. It can be characterized by inclusivity and acceptance of beautiful and diverse identities, including identities of disability. And this can motivate students to be very empowered to take on their positive disability identity and to disclose, whether it's to professors, to peers, to their classmates, so that they are receiving some of that support. Did
We
I
have
miss anything in the chat?
Yep. Mayam asked about informal accommodations, maybe, and she had they had some thoughts about that. So maybe they can share what they were thinking.
Oh, please, yes. You can go ahead. Oh, sorry.
Yes, I'm trying to try to ask or share this brief, like it's the most concise way. So just even from my own experience, and also, seeing kind of the dynamics of, the way that some university, whether I would focus on professors, right? Some professors are very open to just you communicating with them. So, they are open to giving extensions to all the students if they need. So they're very flexible. If you need more time, that's it. That's okay. The challenge is that when there's not consistency, or not everybody does the same thing. So you may go to one professor and they do that, and another professor is saying, no, the first week you need those accommodations. You need to go through that process. What has been seen though with that, and I think that some universities, as I was given feedback, that they're changing their policies a bit to be more lax, because, so for example, neurodivergent students, there's self diagnosis, or even just other, even my own lived experience, I have a physical condition that still doesn't have a diagnosis, yet there's debilitations. And so going through those pathways to get formal documentation is hard. And so, and then that's the only route to really say, like, hey, what do you have? And you almost have to make something up, or even not even necessarily make something up, but find whatever you have that is there. That's not even the source. And so there's kind of like I guess what I'm trying to kind of narrow down is that it gets confusing, because some of the functions within universities are easy to navigate, because it's like, well, these professors are easygoing. I didn't have to go through all that, those challenges of going through the route of the formal accommodations. But then others are very particular about it, and then it causes more stress for the student.
You bring up such,
and then that's when it's like, well, I can't get help from the school, because I have to go through that route, and there's no point in talking about it, because if they feel like the administration is saying that you need to go there, then it's like they've cut off some, I guess what I'm saying, they've cut off the trust and confidence in going informal, because there's other entities saying you need to go through the formal process. If that makes sense. It's just we don't know what the right way is, because some people have fostered a more informal way.
Yes, these are excellent points. There is inconsistency in how professors, from class to class, department to department, school to school, are going to navigate how to support students with health conditions. And it shouldn't be so challenging. It shouldn't be so difficult. It's great that there are some professors that are very willing to support their students, to accommodate their students informally. When you have, though, a cumbersome, a burdensome, an inaccessible process at times to obtain formal accommodations that is a challenge. And unfortunately, to your point, the process of accessing accommodations is rather burdensome. The proof, right, of determining the presence of a disability is on the student. To obtain those medical documentations can be burdensome in terms of finances. It can be burdensome in terms of time and accessing providers. Not everyone has that, equal resources in accessing healthcare providers that can provide those forms, those legal pieces of documentation qualifying a person for accommodations. And so the academic institutions can make the process very inaccessible. Unfortunately, I see exactly what you're saying, and it's a challenge that unfortunately is left to the student to navigate. And if you don't have those supports to navigate it, it could preclude you from getting those formal accommodations. Absolutely, absolutely, great points. Thinking about accommodations, thinking about reasons to disclose, right? We said people disclose for the accommodations. On the flip side, maybe students choose not to disclose. I'm wondering, what has that looked like for the students that you have worked with? What have you seen? What have students shared with you? Similarly, put in the chat, feel free to unmute. What are some reasons students may choose not to disclose? What has come up for the students that you're working with? What have students cited in terms of reasons, barriers, challenges in disclosing?
I'll keep an eye out on the chat, Amy.
Perfect. Again, I've worked with many students, and I've heard a whole host of reasons why students may choose not to disclose.
Worried about change in the way that they will be perceived or treated, Sarah mentions, absolutely.
Yes. Once you put that information out there, Sarah, it's vulnerable to the actions of others. What do they do with it? And they may, right? There's no guarantee. I, as a practitioner, can't say to, if Joni was a student I was working with, there's no guarantee that I could say to Joni, well, if you disclose to your professor, they're not going to treat you differently. In fact, there's evidence that might support otherwise.
Not, as Sarah mentions, again, kind of following up, not wanting the possibility that others will share their private information with others. Yes, so, having those concerns that that information might not stick with the person that you're disclosing it to.
Absolutely. Where does it go? Once it's out there and it's shared,
Yep.
does it continue? Who else gets access to it? Great point, Sarah.
Trauma from past experience due to mistreatment, thinking about those who are coming straight from K to 12, who are now in post-secondary adulthood experiences. Yes, not having the best experiences in the in the K through 12 setting. Also, few professors have made it more difficult for those that disclose, made different exams or harder exams, reluctant to accommodate. Thank you.
Yeah.
Lynn.
Yeah, so you might see, unfortunately, retaliatory behavior, right? There are now more challenges, more barriers, or different treatment after a student discloses. And that can be really hard for students to, assess, is this perceived or is this actual retaliatory behavior? And unfortunately, I have seen both.
Yeah.
And that shouldn't be the case. So thinking about this piece, right, first and foremost, frequently cited, reasons that students may choose not to disclose, stigma and discrimination, right? One of the most frequently cited pieces of barrier to disclosure, concern for disclosure is stigma and discrimination, specifically for mental health conditions, right? Despite advancements in understanding mental health, having a clear idea of what mental health is and isn't. Negative stereotypes are just persisting. They're ever present in our, societal, looking at media, looking at news, looking at social media. We see these stereotypes persisting, right? Students may be fearful of being labeled, misunderstood, treated differently by peers, by their classmates, faculty. There also might be privacy concerns. Students might be hesitant, and this was cited. I think Leanna said, where does it go? Fearing that the information could be misused, mishandled, right? Concerns that others might find out about their condition without their consent. Fears of lowered expectations. Students might be concerned that after disclosing their condition, professors might look at them differently, right? In terms of their performance, their abilities. And this can be detrimental to a student's self-esteem, their self-efficacy, motivation, right? That could all be impacted. Students may decide not to disclose, and this was frequently cited in my experience in support education, from past negative experiences. Students may have had negative reactions in the past, whether in their school setting, in work settings, and they might be hesitant to, go through that experience again, to open themselves up and have that vulnerability of, what does this person do with the information that I've given them? Other students might say, in terms of reasons not to disclose, I don't need accommodations, right? I am good without accommodations. They may have negative views about help-seeking behavior. I know I worked with one student who had schizophrenia, and they were a veteran, and they did not like and did not want to ask for help. They viewed that as a sign of deficit, of weakness. And so they did not want to disclose because they had this strong belief, this negative view of that help-seeking process in terms of what that would mean. Maybe concerns about career implications, right? Students might worry about disclosure because it could impact future prospects and opportunities. I know one student who wanted to access accommodations in one of their, I think they were in a science course in a lab, and they wanted to access their accommodations, but this particular professor was looking for research assistants. And they were concerned that if they were to disclose, they wouldn't be eligible or wouldn't be chosen for that research assistant position, that there would be some negative ramifications. Additionally, students may say that they are less reluctant to disclose because there's some uncertainty about their condition in regards to having a mental health condition and symptoms fluctuating. So a student might be uncertain about, how their symptoms may vacillate, if they could potentially be more severe, or maybe they're less severe at the moment, right? They're really feeling very well, and so they may choose not to disclose because it's unnecessary, right? So when students are assessing disclosing or not disclosing, right, they're looking at their perceived cost, that comes with sharing that information. And we see that many students with non-apparent health conditions make an effort to conceal their condition in order to, quote unquote, pass, right, as a student without a health condition. And other students who choose not to disclose with an apparent or non-apparent health condition, right, may seem to do well academically without formally disclosing. And they choose, again, not to disclose. So thinking about additional factors, there's also this piece about the intersectionality of disability identity and help-seeking behavior. These pieces absolutely come into play when thinking about disclosure or managing personal information. So what does this look like? Disability identity and help-seeking behavior are intertwined concepts, and they are crucial components that can significantly influence a person's decision to disclose their disability, especially in settings like higher education. Disability identity refers to the way an individual perceives and identifies with their disability. This perception influences concepts, self-efficacy, self-esteem, and how they interact with others. Students who have a positive view of their disability, have accepted their disability and view it as a central part of their identity, are more inclined to disclose because they feel this piece of their cultural facet, right? Some students may feel a sense of responsibility or desire to represent or advocate for their community. This can motivate them to disclose, to challenge stereotypes, and promote inclusivity. However, if an individual views their disability through the lens of societal stigma, they may fear negative judgment and may choose not to disclose. If students have internalized negative beliefs about disability, if the campus culture is very negative, this will impact disability identity. They may feel that shame, that guilt, right? Again, speaking to that piece of ableism that was brought up earlier, right? They may avoid disclosure to avoid those perceived judgments, real judgments, right? Both are happening simultaneously, for sure. And help-seeking behavior pertains to an individual's propensity to seek out assistance or resources when faced with challenges. Students who are knowledgeable about their rights and resources available to them, or who have a history of seeking help, might be more likely to disclose because they understand potential benefits. So those past experiences will play a role in terms of help-seeking behavior, right? If a student had a positive outcome from previous disclosure, they might be more inclined to disclose again in college. Ultimately, like, those concerns about academic performance can drive help-seeking behaviors. Students who believe their disability may impact their success might be motivated to disclose to access accommodations, right? So this intersection of disability identity and help-seeking behavior is, again, they don't operate in isolation. They're intertwined, and we should be assessing where a person's at in engaging in help-seeking behavior and what their self-concept looks like in terms of disability identity, right? Providing a little bit more contextual information as we provide services and conceptualize how to support this student, right? So how do we support development of a positive disability identity, and how do we support potentially help-seeking behavior? So we've kind of reviewed anecdotally what goes on in terms of assessing reasons for disclosure, reasons for not disclosing in the academic setting for students with mental health conditions. We've reviewed what's cited in the literature. Ultimately, though, we want to get to know what the person, the student that you're working with, is saying. We want to know what they are in terms of assessing the benefits and disadvantages, right? And how do we do this? We want to be very mindful and intentional in how we work with students in exploring the pros and cons, benefits and costs. And Joni and I come from a specific practice that can support, right, how we approach navigating this conversation. We leverage what's called motivational interviewing, and we're going to encourage that you leverage motivational interviewing to have this conversation with each and every student that you're working with, looking at the benefits and costs to managing personal information for college. Motivational interviewing, commonly referred to as MI, is a person-centered approach developed by Miller and Rolnick, and it's designed to enhance an individual's motivation to change by helping them explore and resolve their own ambivalence. It's unlike traditional directive communication approaches, counseling approaches, because MI is collaborative and seeks to elicit behavior change by assisting a person in exploring their own reasons for change within an atmosphere of compassion and empathy, acceptance and collaboration. So one specific technique that MI, motivational interviewing, employs is known as a decisional balance or payoff matrix. And this facilitates a structured reflection, right? It's a structured reflection on the advantages and disadvantages of making a particular decision. And in this particular example, right, in this context, we're talking about to disclose or not to disclose, right? And so students are contemplating that disclosure of their mental health condition. This instrument can be absolutely assistive, supportive. Ooh, Joni, do we have some things coming in the chat?
Yes, we do have something. Let me bring it up. Also misrepresenting their racial ethnic group if they're the only one who represents the group. For example, they can't ask for help for the school to see that this group has deficiencies in intellect or abilities. If you want to describe, explain that a little bit more, that would be great.
Yes. So if I'm hearing this correctly, if a person is maybe coming from a background from a historically minoritized racial group, that person may not want to ask for help because they might, the person they're asking or seeking help from might perceive that as a deficit to that entire racial group. Am I reading that?
Yes, or perpetuating that stereotype.
Yes, yes. So they have to be mindful of not only the ableism and bias, implicit bias regarding mental health conditions or disabilities. Now there's that intersectionality of trying to manage the implicit bias or the racism and prejudicial treatment from individuals coming from potentially historically minoritized cultural groups. Absolutely. It's putting that student experiencing that intersectionality of identities in very compromising positions where they are now trying to navigate a system of oppression and a system of injustice in terms of getting access to their supports. Absolutely. Great point.
Excellent point.
So thinking about this MI approach, right? We want to guide the students through a process of self-reflection. They can weigh on the pros and cons of disclosure, managing personal information in a manner that feels personally relevant to them, right? The inherent power of this method, it lies in the autonomy and the personal relevance it grants to the student using it, right? When the student generates their own list of advantages and disadvantages, right? When that's being populated by the student, right? The conclusion that they reach are going to be more intrinsically motivating for the person and resonate more deeply than if you or I or any counselor or practitioner provides a pre-made list, right? Of like what we just reviewed of the literature, right? A self-generated list from the student is going to really support a meaningful decision and ensure that that decision aligns closely with the student's unique circumstances, values, beliefs. Using this approach will empower students, bolstering confidence and helping them to really make that informed decision about their own lives and how to proceed, right? So in essence, this decisional balance exercise within MI aligns with the adage that the individuals are more likely to be invested in and act upon conclusions they draw themselves rather than directives that are posed from us or anyone outside. It's helping them to really navigate that intrinsic motivation. What do we think of this? Is this something that you would leverage and utilize in your work? Would you have students create a pros and cons list of managing personal information, right? What is positive about it and what is potentially negative or detracting about that option? Go ahead and put that in the chat. Because ultimately, what we want to support the student in doing is making an informed choice. But also, I think it's our due diligence in helping students to prepare for that choice to avoid consequences, right? That we see, unfortunately, throughout schools nationwide, throughout students with apparent, non-apparent health conditions. And I'm referring to, disclosure regret. That is, unfortunately, something that we see can be very prevalent. And we want to know how to assist students, right, in preventing that. So what do I mean by disclosure regret? It's after the act of disclosure, a student may have negative feelings about that experience, may feel guilt, shame, remorse, the desire to, have made a different decision, right? And we see a study conducted by Mark Salzer and his crew at Temple University. They conducted a national survey for students specifically with mental health conditions. In this study, there were 382 participants from 300 or more post-secondary education institutes, and they looked at students who were obtaining academic support. What was their experience of disclosure? And we found that of the 382 students, 56% of them reported feeling embarrassed or bothered by disclosing their disability to faculty, right? There was a negative feeling associated with disclosure. 56% of those students also reported being fearful of being stigmatized by faculty, right? So over half of those students had that fear that there was going to be stigma after sharing their health information. 42% of the students reported that faculty were uncooperative or unreceptive. So for those 42% of those students, they didn't have a positive experience. They didn't see the results that they wanted to, right? That faculty member was not receptive, as we discussed earlier, right? Faculty, teachers, professors may really differ in how they respond. 41% of those students reported being feared or fearful of being stigmatized by other students, right? So previously we noted 56% reported being fearful of being stigmatized by faculty. 41% were fearful of being stigmatized by their classmates. And then 31% reported miscommunication or a lack of communication regarding accommodations. These students also reported that these barriers resulted in underutilization of accommodations. After this negative experience of disclosing to access accommodations, the majority of students felt like they underutilized those accommodations because of these negative feelings related to disclosure, right? So we want to be mindful that this happens, that students may experience disclosure regret. So how do we ward that off? And we're going to reference right back that model that Joni was talking about earlier with Waghorn. First, starting with knowing the student's legal rights. We want the student to first and foremost, after they devise their pros and cons list, and they've decided to disclose, or potentially decided to disclose, we want to provide their information about their rights. So that's going to start with the ADA, Title II, right, and Section 504. These pieces of legislation have significant implications for higher education and students with disabilities. First and foremost, Title II of the ADA prohibits public entities, including colleges, public colleges, and universities, from discriminating against individuals based on disability, right? So colleges cannot require disclosure of a disability, but students wishing to receive accommodations must disclose their disability to the appropriate office. What does that mean? So we want students to always know that the nature of their health condition stays with Office of Disability, and the nature of the disability never has to be provided to the professor under any circumstances, right? They do not have to share the nature of their health condition with the professor. Additionally, institutions cannot retaliate or discriminate against students based on disclosure. And once that student discloses to ODS the nature of their disability, right, ODS, Office of Disability Services, the institution must provide those reasonable accommodations that were approved. If they do not provide those accommodations that were approved, right, then there's recourse for that student to follow up with Office of Disability Services and have some advocacy efforts provided so that professor can be aligned with ultimately the law, right, the ADA. Section 504 prohibits entities that receive federal funding, including both public and private colleges, universities, from discriminating against individuals based on their disability. So as with the ADA, colleges and universities cannot require students to disclose a disability. However, to receive accommodations under 504, students have to disclose presence of a disability to ODS. Same thing applies. So thinking about this particular piece, these two pieces of legislation, they protect students from discrimination. They secure reasonable accommodations. Reasonable accommodations meaning that it doesn't provide undue hardship to the university and doesn't modify the requirements of the course, right? And this can safeguard, having this piece of education can hopefully empower students to safeguard their rights, their civil rights, as well as what's afforded to them by law. And we also want to build disclosure efficacy, right? Joni talked about this earlier. Decreased efficacy is one reason that individuals avoid discussing their health conditions. And increased efficacy is associated with increased disclosure intention. So the more a person feels like they are confident in their ability to share information, the more likely they will share that information to the extent that they want to, convey and share information. Increased efficacy is also associated with less topic avoidance, right? When individuals report being confident in their abilities to share their health conditions, they are less likely to ruminate about how to share the information, and their overall anxiety about disclosure or managing personal information decreases. This will set the student up to have a better experience. So we want to build disclosure efficacy. And how do we do this? Well, we see in research, right, thinking about this study that Joni cited earlier, we build disclosure efficacy by building a disclosure strategy. When students are prepared to disclose, knowing the mode of disclosure, right, if that disclosure is face-to-face, via Zoom, right? Is it on the phone? Is it via email? What's the mode, right? That builds disclosure efficacy. If the student knows the context of the disclosure, right? What does that look like? The time, the setting, with whom? Whom are they disclosing to? And then the what, the content of disclosure. What is said? How much information is provided? Is it incremental disclosure, or are they, doing the rehearsal, the practice and disclose? So we want to ultimately build disclosure efficacy by building a disclosure strategy. And Joni's going to walk us through that.
Great, thank you, Amy. I'm going to get right to kind of looking at the why, when, how, what, and to whom for the disclosure decision making. And the reference here on the slide will get you to some good resources that expand on what I'll discuss. But when we talk about the why, as you all mentioned earlier, many people choose to disclose because they need an accommodation. There might be other reasons, like you mentioned, not hiding or being able to advocate and so on. But in general, there are the reason that many people choose to disclose is to receive those accommodations. When we think about when, you can kind of conceive this when as maybe 5 time points prior to enrollment. So someone may choose to disclose if they need an accommodation in the application process at the time of enrollment. So if a student anticipates that that they'll need an accommodation to complete the classes based on maybe other coursework that they've taken, it would be important to disclose at that time. The student wants to be mindful, though, that disclosing a disability before you have, you want to help the student really make sure that they're disclosing before any problems occur, right? So, at the time that they've already missed several assignments or several, missed exams or have done poorly on exams, you want to help them identify early on when it could be beneficial to disclose this information to receive an accommodation. Maybe during the course of the study. So maybe the student isn't aware of their need for an accommodation until they're getting into the coursework and they realize this is necessary for me to pass, and I'm going to request this accommodation. Maybe someone's just recently diagnosed with a mental health condition or other disability during the course of their semester, and they may choose to disclose at that point. And then some students, as we saw, may never choose to disclose, and that would be discussions that you may want to have with the person, just in terms of accommodations and accessing the accommodations. The how, again, focusing on that strengths-based approach and really helping the person focus on their abilities and practicing how they might describe to the Office for Disability Services, what some of their skills are, what some of the needs might be, what information might the Office for Disability Services need to know about the disability that the person has. Maybe there might need to be some sort of documentation. So I think it's important to really help the person understand what's necessary. And then the to whom. So Amy mentioned, some of the research around professors and other students and some of the stigma related to disclosure. So really a student can disclose to the Office for Disability Services or Accessibility Services. If the school doesn't have one, maybe there's a dean of services or a dean of students, or maybe the advisor. But as Amy mentioned, the professors don't need to know the details or the nature of the disability. They're really just provided that information about the accommodations. So check out the resource listed. I kind of went over that in a quick manner, but the resource here has lots of good information. Developing your script. So here are some different ways that you can support students in developing kind of a script or rehearsing what they might say. So describing the positive attributes and strengths first. So again, rehearsing with the person, what are their strengths? What are their positive attributes? Identify the limitations that or challenges the person may face because of the disability. So kind of talking through that. Also identify which accommodations may have worked in the past and why, and maybe even consider which ones didn't work and why. Help the person think about who they might disclose to and what outcome do they expect. So if they're thinking, I'm going to disclose to my professor, like lots of details about my disability, and I expect this particular outcome, that could be really important counseling that you can do with the student to help them really look at why are they expecting that outcome? What if they get a different outcome, to really help them prepare for any of those inadvertent disclosures. And then kind of always end it with some positive points. And this was modified from some information relevant to employment, but also certainly applicable here in the education sense from the Job Accommodation Network. I don't know if anyone is familiar with the Job Accommodation Network, but I would suggest popping on their website to get some good resources as well. And then we're kind of wrapping it up into the education retention stage. Remember, that was that third stage that Waghorn and colleagues identified in terms of managing personal information, really helping the students modify the script that we just looked at for each class and maybe each semester. Helping them look at, is anything changed? Has anything changed? Is there anything unique that this semester or this class might involve? Helping to identify strategies for social situations. So what would be some examples of social situations that students might need to really plan how to manage that personal information? What do you think those social situations look like, and what strategies might you help the student employ?
I have one student, Joni, that would take their exams in a distraction-free room.
Yes.
And they also had time and a half. And every exam, every quiz, they were not in class. And students started asking,
yes,
where were you? Did you not take your test? And so we had to prepare using these strategies.
yes.
How do you respond to your classmates?
Yeah, I think I'm thinking of a time when I was actually in college and a student had extra time. And I remember students would ask about that. And you could kind of even remember thinking back, million years ago, but you could even remember his discomfort and reluctance and uncertain of how to respond to that. So yes, that would be an example of those kind of more social situations to help the student plan for. And then modify the accommodations if needed. Amy had mentioned earlier, there might be changes, the room might be different, or the professor's teaching style might be different. So those accommodations may look different per class, per semester. So we're going to attempt to pull it all together in these last few minutes. So this is just a brief kind of example that we wanted to kind of get everyone thinking about. I'll read it. Jane is interested in completing her undergraduate degree. She's enrolled in the local community college for the fall semester. She has some education already in her chosen field, but she needs to complete an additional 21 credits. She hasn't been in school for a while and is uncertain if she should disclose to her school that she has a diagnosis of bipolar disorder. So we pose some questions so we can open it up and have a discussion, unmute your mics or in the chat. What would you do to assist Jane in exploring this decision? What are some considerations to her decision-making around managing personal information? If you want to unmute your mics, that would be great. Have a little bit of time to talk through some of this, and hopefully the scenario can you can recall this and some of the solutions as you're working with students.
Absolutely. What would you pull from today's session to help? Oh, sorry. Go ahead.
I think someone was about to respond. What would you do to assist Jane in exploring this decision? What are some considerations to her decision-making around managing personal information in this scenario? What are some advantages to Jane disclosing? What do you think some of the advantages? Remember, Amy went through those reasons why and reasons why not to disclose. What would be some of the advantages to Jane disclosing in this situation? A minute.
And you could unmute for any brave soul who'd like to share how you'd approach this.
We're essentially begging you, please unmute and share.
Or you could type it in the chat.
Or type it in the
if
chat.
That feels right.
And more importantly, you're thinking about it. It'd be great if you can share, but kind of thinking about how you would help a student similar to Jane, talking through, what are those considerations? How would you assist?
Hi, everyone.
Hi, Leanna.
Hey. Hi, I'm Leanna.
Thank you.
I guess I'll go. This is a pretty interesting case because of the diagnosis of her disability. So I do think she should disclose to like the office if they have accessibility center there. Directly to the professor. I'm not sure if that would be a good idea to state, because this is kind of like protected information. And, like how certain people look at bipolar disease. I don't know if that'll be a good thing or not. Some advantages might be like if she needs accommodation with like extra time or like missing classes, or if she needs breaks to like take medication or, anything like that. Absence from class, that would be a good thing. Disadvantages would be, I don't know, being frowned upon, treated differently. And strategies is like, I guess discuss with her what she feels comfortable with. Does she want to disclose this information to others or just to the office? And then the office just, disclose to the professor like a general information, like based on this person's disability, they require these types of accommodations, but not really be specific as to what it is. Yeah, I think that's my take on it.
I think that's
Thank you.
a wonderful take. Thank you for your bravery and for really touching on all those important questions here. And I really appreciate that you mentioned, the fact that Amy and I intentionally put the full diagnosis on here to kind of elicit that response that you just gave, Leanna, about, really being mindful of the types of information that you need to disclose to professors compared to the ODS or accessibility services, and the stigma that may be attached to some diagnoses. I think that you're right on with talking about the advantages and disadvantages, and then also touched on what the strategies might be, really helping talk through and think about how Jane might, rehearse her script almost to the Office for Disability Services. So thank you for sharing that great information. And Amy and I are going to wrap up. If we don't have any other people who would like to respond to this, but thank you, Leanna. We appreciate that. And Amy, if you can go to the next slide.
You're welcome. So what would be the right thing to do you think, in that scenario?
So thinking about Jane, you might want to start with that psychoeducation in terms of sharing a little bit of information with her in regards to the ADA, what her rights are, what the accessibility service is in terms of the campus and what they do, and then use some of that motivational interviewing, using some of that MI to the pros and cons list to explore, what does Jane think in terms of the advantages and disadvantages? What are the benefits that she identifies in terms of disclosing? And what are the costs to disclosing? And once she's identified those pros and cons, she could determine how she wants to proceed. Do the pros outweigh the cons? Do the cons outweigh the pros?
Okay.
And if she decides to disclose, then you can help her using the script, right? Determine how you want to disclose, who you want to disclose to, when do you want to disclose, right? All of the pieces to building disclosure self-efficacy, right? Knowing the mode of communication, the content, and the context, the setting, will help Jane to build her sense of empowerment, her sense of, again, just this coming from a place of feeling like she has leverage, like she is able to positively advocate for herself and for her needs.
Okay, awesome. Thank you.
Yeah, no, you were spot on. And I want to definitely highlight, when speaking to the professor, it's the least amount of information needed to get what they're looking to receive in terms of supports. The ADA does not require a student to disclose the nature of the disability to the professor, only to the Office of Disability Services. So leaving that diagnosis out is well within her right. And often we emphasize the least amount of information to a professor to get your needs met. Thank you. Great question. So we are at the tail end of our session for today. Again, to summarize, we want to look at this piece about the term disclosure and maybe try to incorporate a little bit more of managing personal information to minimize negative associations. We identified there's benefits to disclosure and managing personal information, and there's costs. And the best person to identify those benefits and costs is the student themselves. And we have tools in our toolbox, like motivational interviewing, the pros and cons to help them do that. And we can effectively use managing personal information to support all stages of entry into school and retention in your academic programs. Thank you so much for attending today's session. I know we are at the end of our session.
I'm gonna put my email address in and Amy's. If you want to give us an email, if you have any further questions.
Thank you everyone for attending. In the chat, I included a link to our short evaluation survey. And as a reminder, we will be emailing everyone a certificate of completion within 7 days of this webinar broadcast. Next slide, please. And again, we welcome you to connect with us via our social media handles. Where we can be found at Facebook, Twitter, and LinkedIn at Northeastern Caribbean MHCTC. Again, I want to thank everyone for joining us, for your active participation. And we hope that you can take this information today and use it in your work. We hope to also see you at our upcoming training events. And again, I want to thank Amy and Joni for providing us with the wealth of information in our webinar. And we hope you have a great rest of your day. Thank you.
Thank you, everyone. Have a great day. Bye.
Bye, folks. Thank you.